I'd like to take notice of the minutes. I'm sure all of you saw them and enjoyed reading them. Any thoughts on those?
I'll move it.
Motion approved. Thank you, Gary. Thank you, Gregory. All those in favor?
Aye.
And
Aye.
those opposed? That will carry. We'll jump right into Diana. How are you, Diana?
Great, doing well, thanks. How about you?
Great. We're doing good. We got 2 items on your list. Is that right?
Yes, that's correct. One of them is a contract renewal. It's for the personal emergency response systems. We've had these for a number of years. And we did increase the contract in our 2020 budget this year up to $17,390, not to exceed that. And it is covered by our Title IIIE Caregiver Support Program Fund, Unmet Needs, ISEP, and there is a 75% match with anything from ISEP from the county.
I'll move it.
Sorry,
you, Gary.
25% match from the
Thank you,
county.
Thank you, John, for the second. Any discussion in regard to this? Everybody good? Hearing
Good.
none, we'll vote. All those in favor?
Aye.
And those opposed? We'll carry that one through. Second one, Diana.
Great, and the other is also a contract renewal. This is for our meal preparation program with the ARC, Genesee Orleans. And the total contract for this 2020 budget year is $310,909. Again, it's all covered through funding that we've gotten not only from the major disaster declaration monies, but also just our regular 3C grants, WINEAC, things like that.
So move.
Thank
Second.
you. Thank you, John. You know, John, sometimes when you take a glass off in an auction, that means you're bidding. So I'm going to take that as a second.
All right.
Any discussion in regard to this meal prep contract? Hearing none, we'll vote. All those in favor
Aye.
and those opposed? It will carry. Thank you, Diana.
Great, thank you. Take care, everybody.
Thanks.
David, we have you and we also have Carla, I see. Welcome, Carla. Thanks for coming to us.
Thank you.
Yes, you do. This was tabled on March 30th. I think you have to,
Andrew, I'll make a motion to take it off.
From
the
Gregory to untable that and a second from
Yep.
Gary. Thank you.
and
All those in favor of taking this off the table, please say aye.
Aye.
And those opposed? All right, we're back about a discussion. You have some words, either Carla or David?
Yep, go ahead, Carla.
Okay, can everyone hear me?
Yes.
Very
Okay. So I just wanted to briefly explain this. I know with everything going on, adding positions right now is, makes everyone a little nervous, but essentially what we're looking to do. So we pay for homeless placements in the county. It can potentially be a very big expense. We have to monitor the homeless placements. We have to follow up on them. We had a liaison who was managing all of this for us. So a caseworker was in that position for many years because of some changes that were made probably 20 years ago. So it really was not appropriate to keep a caseworker doing that. I don't need a caseworker for that position. I, need someone that's more in the programs area. So we gave the caseworker back to services where they were desperately needed, but we still need these duties filled. And basically they are, like I said, they're finding placements for homeless. There would be case management of the homeless to follow them through to try and find permanent housing. There also another added thing to this is that the homeless management information system, which is a relatively new data system, everything has to be entered into that. It's very time consuming. I have a supervisor in programs doing it right now. She's really not doing everything she could be doing because she just does not have time. So this position would be doing that as well. That drives funding. We actually got a grant of $45,000 to help with this project. So actually we've been using a little bit of that towards the program supervisor salary. The rest of that is going to go towards the salary of this position. And then, moving forward in 2021 and moving forward, there is funding for this position. It will be, 50 to 75% reimbursed. All of the services and the tasks that this person will be doing are mandated. So we have to get them done. And I really do not have someone else to do it. And as of right now, we're already kind of lagging behind because we did put the caseworker back to services and I need someone to do this. So to do that, we're looking at eliminating the youth worker position because we have cluster homes in our county to put at-risk teens, and we just don't have them full anymore. So we really, that position has been vacated for a while, and we feel that we can do without that to kind of make a swap. It's not an absolute even swap. There will be a little bit more in the budget for this position, but I think it's about, I think $2,800 more. It just was a much more appropriate fit for this. And again, these tasks are mandated and they do drive funding for our area.
So how is the position funded, Carla?
So we get reimbursement through, administrative reimbursement through the state. It can come because this person will be working with potentially TANF clients, safety net clients, potentially even some of the SNAP. I mean, because they might be touching several programs, we get reimbursement for all of those. So we could allocate some of that to the salary for this position. And potentially, if we're using the homeless management information system, that also opens up the opportunity for more grants to the counties to help fund these it's now mandated to use this HMIS system, which it was not before. So the caseworker in the position prior was not using it, but we have to now, and it is going to drive some funding. So they may even extend this grant into next year. I don't know. That's not a definite, but especially because of COVID-19, and we haven't had the opportunity potentially to use all the services we normally would have, that may even extend into 2021 to be able to claim some of that there too.
Mr. Chairman,
Yes, please, Gary.
Carl or David, how do you know it's either 50 or 75% funding, as you mentioned? How do you determine that?
Sure. So different programs provide a different level of funding depending on the program. So we'd have to look at, they do time management studies, the workers. So depending on which program they had worked, the majority did the majority of their time, and that would then determine which program we could pull funding from for their salary.
Thank you.
So someone that works solely in SNAP, they can only, get money out of SNAP administration. But this position will touch more than one program, so we would have more opportunity.
Other questions from the committee? I think, again, just a couple of weeks ago, not that we're not now, but A, I don't know that we understood it well enough, and B, just the mood at the time and the cost and I think we just were probably being more cautious than anything. I'm happy that you're back, and I'm happy to get additional information, and I support it, and we'll see how the rest of the committee thinks.
Okay, thank you.
Any other questions or comments for Carla or David? All right, well, you good, John?
Yeah.
Looks like you're thinking.
Good. I like the idea of the different resources she can tap into. So much better that with the information now.
Okay, so we're going to vote for the salary schedule amendment. All those in favor?
Aye.
Aye.
And those opposed? That's going to pass as well. Thank you, Carla and David.
Thank you very much.
Thank you very much.
Okay, thanks for coming. Do we have Superman Paul Pettit on?
Yeah, just in time.
Good afternoon, everybody. How are you guys today?
I'm doing
Good,
great.
Paul.
How about you?
Plugging along.
You
So,
got some extra time, do you, Paul?
what's that?
You got some extra time, do you?
Is that what that's called? No, not too much. You have some to spare?
Yeah, all right.
Could
I'm
use
sure
a
you've
few
been
more
running around
hours
like a
a day,
chicken.
that's for sure.
I hope it's going well.
Yeah. All right. So 4 resolutions for consideration today. The first one is to apply for a new grant. Although that's resolution number 4 that's up on the screen.
There's not a resolution to.
Oh, yeah, this is just, sorry, it's just permission to apply. Yeah, so, in line with trying to find new sources of funding, et cetera, and non-county related, I have a lot of my folks that do searching for different types of grants. So we're looking for permission to apply. The Awesome Foundation Grant Program is one that's out there that, has in line health-related grant applications. And as you guys are aware, we've had a Radon grant from the state of New York for the last 5 years. That grant is ending. And what we'd like to do is apply to this foundation to get some additional test kits that we can give out to county residents so they can test for radon, since we're not going to have a supply any longer to hand out. So again, we thought it'd be easy. It's easy application to apply for. If we get it, we'll be able to purchase, I think it's upwards of another 100 kits that we can then hand out to county residents to do radon testing in their homes.
So moved.
Thank you, John. Thank you,
Second.
Greg. Gary, I'm sorry, it was Gary. Questions, comments for Paul in regard to the awesome grant?
Paul, then this is a new grant?
Yeah, Gary, this would be a new grant application. It's just a one shot. It's a real easy application. If we get it, we can get the kits. If we don't get it, we just move on.
Thank you.
Yep.
Anyone else? All those in favor?
Aye.
Aye.
All those opposed? We're gonna call it good. Thank you. Permission is granted.
All right.
Grant.
And the next one is grant acceptance. So this is our drinking water enhancement grant. So essentially, this is the money that the funding that we receive to help offset. I'm sorry, mine's out of order for some reason. All right, so this is the emergency preparedness program. So again, this is another grant that we have on here. This is to accept funds from the state of New York. It helps offset local costs for our emergency preparedness program, which obviously is being utilized somewhat more so than ever right now. So this is good funding to continue to have. It helps pay for our staffing. And this is a shared position with Orleans County. They also get the same amount of funding. And so we put that together to pay for our FTE in the program.
So moved.
Thank you, John. Thank you, Gregory. Any discussion? All those in favor, say aye, please.
Aye.
And those opposed, same sign. We'll carry that one through too. Number 3, Health Department lab testing.
All right. So this is a renewal with NMS Labs. So they're the ones that do all the lab testing when we have send folks in for autopsies to the medical examiner in Monroe County. All the lab work is sent out to NMS Labs. This was done, I think, about 1.5 years ago now. So essentially, nothing has really changed with this. It is an $8 increase per toxicology test that they run. But again, this is a required part of our medical examiner program.
Move it.
Thank you, Gary, and thank you, Greg, for a second. I had a question, Paul. We got a lot better service from them, right, in terms of turnaround time, and is that still the case?
Yeah, so things have been running very smoothly with NMS Labs overall. This obviously, as we're well aware, going back a few years, we've had historically some significant issues with getting autopsy results back from Monroe County. Medical examiner sometimes in arrears up to a year almost, unfortunately. A lot of that was lab driven. So with NMS Labs, a private lab being utilized now, we are getting things turned around fairly quickly, sometimes even within a week or less when those results go there, especially for toxicology testing.
Awesome. Further questions or comments from the committee?
Oh, Paul, is this just toxicology or blood and toxicology?
They do both. Whatever type of testing needs to get done. So depending on, again, whether law enforcement or, a doctor, whoever may be ordering the autopsy, they can ask for different types of labs to be run.
So they do blood alcohol?
They can. We don't typically do that through us, as you know. That's done through the Sheriff's Department with Monroe County. But, yep. We're just doing it on the for the autopsy part.
Do you have any idea if the Sheriff's Department has the same turnaround trouble that we've always had with Monroe County?
I can't speak to that, no.
I just wonder if it's an option for the sheriff, this company.
They may very well be using a third-party lab too through Monroe County. I can't speak to their arrangement with them, but I know, again, they utilize Monroe, and I know Monroe for a fact they're actually using NMS, even though they can do it in-house. They found out that this is a lot quicker and cheaper. So I know they're actually using this service too.
That's when you know you're inefficient, right?
Well,
all right. Any other thoughts?
That sounds good.
Hearing none. All those in favor?
Aye.
And those opposed? We'll carry that one through as well. Last one.
All right, and then this is the Drinking Water Enhancement Program. So again, this is a long-term grant from the state of New York. Essentially, it's funding that we utilize to offset local costs for our employees that work within this program. And again, this is monitoring and oversight of the water systems and testing, et cetera, in Genesee County.
So moved.
Thank you, John.
Second.
Thank you, Gregory. Any discussion? Then we'll vote. All those in favor
Aye.
and opposed? We'll carry that one. Paul, you need anything from us?
No, I think we're in good shape. We're plugging along, putting out the reports. We're in phase 2. We're rolling along. Numbers in the community seem to be holding pretty steady, 0 to 1 to 2 a day. We're finishing up our nursing home testing program that we've been working on with the state. We should have that done for Genesee County this week. We have not seen, knock on wood, any type of positive cases coming out of that, which is a great thing.
Excellent.
So, things seem to be moving along pretty good, and we're pleased with where we're at. Hopefully we can continue up with the good numbers.
Great. It was nice to see that 0. Was it yesterday or today?
Yeah, we don't get that too often. So the more we can do that, that's going to be very helpful to us.
Awesome. Well,
All right,
thanks for all your hard work.
Thanks.
All right. Thank you very much, Paul. We'll move to Linda and mental health. Do we have Linda?
Yes, I'm here.
How you doing?
I'm good. How are you?
You're doing great. You got a couple of things for us today?
Yes, I do. The first one I have is a budget amendment request for the mental health department acquiring laptops and technology. We had, after the budget was already sent in, probably March of 2020, we received an opportunity from Flips to provide them with some reports and data. In response to us providing that, we would receive about $48,000 in funding, which we had not figured out what we were going to do with yet. It was going to go into like the larger pot. After the pandemic hit, it was very evident how important telehealth services were. We were already starting with telehealth services for our psychiatrists. However, with having to reduce the workforce, still providing services to the community, all the clinicians then had to switch over to telephonic or telehealth services with the emergency regulations. And our numbers have continued to increase over time. So what I would like to do with the money received from Flips, I have here $25,000 budgeted for all therapists to receive a laptop, headset, and a docking station so that they could potentially work in the agency or on site and or at home if needed. The 25,000 is actually less. The estimates just came in today, so it's more of like $15,000 that would be needed of the 48,000. But I really, as an agency, we really need to progress in this fashion and utilize telehealth services for all the clinicians, not just the psychiatrists. And it definitely provides an alternative method of treatment for our clients who are definitely not going to be ready to come back on site to receive services. That's going to be a gradual process for them. So this, by providing this, by obtaining this electronics, it'll just allow us to be a more progressive agency. I look at it as a long-term investment.
I would like to know what FLIP stands for.
The Finger Lakes Performing Program Services. All of the Finger Lakes counties have, I want to say it was out of the Medicaid redesign teams. And we had, there wasn't any more money originally, and then they found some additional money. So they identified certain funding streams for all the different counties to kind of get up and running with certain programs. And the 48,000 for this recent project was very unexpected because it was assumed that they had no more money to give because of the financial deficit that the state was in and the Medicaid cuts and things of that nature. So when we received word that Flips needed some data collection, some reports from our services, it was a good exchange. Bev and the agency worked very hard to provide those reports, and we already have, we've already received the check in hand.
Good, thank you.
So Pam, the motion was from Gary and John seconded it.
Thank you.
Other questions or thoughts?
I think this is gonna be the way of the future.
Yeah, I'm glad we can provide these services like in this way. So I support it.
Great, thank you.
Well, let's make it official. All those in favor
Hi.
and those opposed? All right, it'll carry through. Thank you.
Thank you. Thanks, Diane. Linda.
And then next on the agenda is my department review. I provided a PowerPoint summary. Not really knowing how the previous administration provided you with a report for year end. I like PowerPoints, so I provided you with a pretty detailed overview of Genesee County mental health, looking at our past, present, and future. I certainly don't have to go over all the slides unless you'd like me to, because there's over 30 slides. If you would like, I could probably just summarize. I don't know if you've had a chance to look at it.
I think we've all seen it and I thought it was pretty good, actually. Thank you. Any summary or thoughts that you had or particular things that you want to talk to or any questions that the committee might have as well?
So I think the agency has been through some turmoil, obviously, over the last year. But I want to recognize that the level of service that they've provided to the clients never wavered, which really speaks to the quality of professionals you have in the agency. Even with the pandemic, they provided services without interruption and continued to just do what they do. Overall, I think the agency wants to be progressive. I have, I'm always agencies are always going to have a couple outliers that maybe question things. But I want to say for the most part, the group of people at mental health want to progress with changes. They're excited for the changes. They love the fact that we can probably offer telehealth to all the providers. So we have some big plans moving forward. Most importantly, one of the major things that I took on as soon as I got there was ensuring that the building was a little bit more safe. So we definitely have come up to speed with where DSS was in regards to just workplace safety. One of our missions is to really decrease the cost for the county. One significant way doing that is by getting the billing folks together, having them cross-trained now that we have our new electronic medical record going live July 1st. It's really going to mainstream how we conduct billing. It will be a smoother process, less hands in the pot. We're going to be going with a clearinghouse, which is going to be really great. So I really think the agency is moving in a very good direction. And I enjoy being there.
Good.
Chairman?
Questions, comments? Linda?
Gordy, have a minute?
Please, Gordy. Yes, thank you.
On behalf of the board, I sit on the board, and I'd just like to say that Linda came in at a very difficult time and has done a wonderful job. I know I speak on behalf of the board. She's done a great job under very difficult circumstances, and I just would like the legislature to know that.
Thank you for sharing that. We appreciate it.
Chairman,
Andy, it's Marianne.
Other thoughts?
When you get a minute, I'd like to just comment and say that I thought her department review was very well done. It gave us lots of information, and I support all the progressive actions that she's taking. Thank you.
Thank you.
I agree. I thought it was well written and included exactly what we kind of need to know. I thought both department reviews for this meeting today were awesome. Thanks for doing that for us. It helps a lot. We're a little detached sometimes, so to see it here and then allow us to ask questions, it helps us a lot.
Good.
Mr. Chairman,
Yes, Gary.
Linda, you mentioned in your PowerPoint presentation about some cuts and possible shortages. Could you go into more detail on this?
Let me see, can you specifically, you said shortages, I'm sorry.
Under, yes, under your building and finance highlight, you're talking about expected cuts
Yeah.
around 450,000, and you talked about state aid, if the state aid remains intact, to be 235,000.
Yeah, so those are all projected losses. And when I submitted this, we were potentially looking at a 1.5% Medicaid cut. And then after I submitted this, of course, the governor came out with agencies that are exempt from the 1.5% Medicaid. So that will save us about $51,000 in projected loss. The other one is the state aid losses, which all county governments are potentially at risk of being hit with. And again, I want to say that the governor identified 20 to 50% cuts in that state aid. With the pandemic hitting, obviously the state is in a very significant hole. However, the governor also talks a lot about the need for mental health being an essential service. So projected somewhere in the middle is where we decided to go. And it could be upwards of $450,000 with those specific cuts. And whether the governor decides to do that or not, I don't quite know that yet.
Well, that's still an unknown at this time.
It is an unknown, yes.
I had a question, Linda. You mentioned in one of your slides that your billing was up a substantial amount over the last 3 or 4 months. Is that because we're doing a better job billing, or is it because the demand has increased, or?
I think it's probably both. I think it's fair to say that it's both. One of the main tasks that I had going in there was to really look at billing, and it was very disconnected. So all of the financial clerks have been cross-trained, and they're going to specialize in specific insurances so that each financial clerk can become an expert in one particular insurance. So they have done a lot better with really just knowing what their role is and following through and bridging that gap of disconnect. In addition to us seeing a high demand right now of a need for services. We're just starting to get some funding in from all the telehealth services. It's really hard to predict what the other insurance companies are going to do, if they're going to follow suit with Medicaid or Medicare and pay the full rate or not. So that piece is unknown, but I do think that we have gotten better with the billing in and of itself. Again, because they're working as a team, and my philosophy really is to break down the silos and work together and help each other.
Awesome. It sounds like you're doing just that. I mean, things seem to be going well, and we appreciate your hard work.
Thank you.
Anyone else? Thoughts or questions?
Good
Thank
job.
you.
Yes,
Thank you. Yeah, and thanks to our other legislators for commenting. We appreciate
Yes.
it.
Thank you very much.
All right. Have a great day.
Thank you. You too.
All right. I think Jocelyn is up next. I don't have my agenda now because I went to something else, but is that correct?
Yeah.
I'm here. Hi, Jocelyn. How are you?
I'm well. How are you?
We're doing great. All we have is a review for you, which again, I thought was just really good in a lot of regards and covered a lot of stuff that helps us very quickly understand what it is you're doing every day and the successes you're having and the struggles.
Mm-hmm. I'll touch on a couple of areas, and then anybody who has questions will go.
Please.
So our youth court, this previous year in 2019, we had 30 cases presented or referred to our court, which is the most we've ever had, I want to say. 60% of those, 18 of those were received in the last 3 months of the year. So Chelsea Elliott, who's our program coordinator, as well as Chelsea Green, who is our program assistant and is there every night with her, doing intakes of 18 young people, as well as processing their hearings. She was within your facility at the old courthouse every 2 weeks, on top of having the training. So I think one of the things, and I believe one of the questions maybe was raise the age a part of that. At this point in time, no, we just have law enforcement really involved in utilizing this resource now, as well as schools and having the resource officers. So, you know, a majority of our referrals were from law enforcement, whether they are within our schools or in the city or the sheriff's department. But it kept her very busy throughout the fall months and into the beginning of the year, because several of those cases had to carry into the beginning of the year with the accessibility to the facility, as well as scheduling 18 hearings within 3 months. One of the things that was positive out of that is she had a 15-year-old young man come through for criminal mischief. He was having a lot of issues at home. His disposition encountered 35 hours of community service, 3 essays to write for reflection, a letter of apology, and anger management. A lot of his issues were with his father specifically. And as a result, she placed them to do community service at our local animal shelter. And because of his age, they asked that a parent be with him. And it was something that he and his father did together and have continued to do. So on top of completing his community service hours, building the relationship with his father, which is something that was vital to his success, they are still supporting our local animal shelter. And he's one of our positives, or our positives out of our youth court system. They're all very positive, but that's one that really stood out, and she reported on in our last quarter to DSS. Our newest thing is our SEY, or Safe Harbor program. SEY was, the initial year was 2019, and that's funded to the youth bureaus. And Safe Harbor we transitioned to in 2020. That funding goes to DSS for a 5-year cycle. It's a bell curve. So this is the lowest amount, and it'll increase every year and then come back down on the 5th year. We are in contract with DSS for this program, much like our youth court, where we have established the program, and we will continue to move forward with the implementation with their support. They are part of our critical team when it comes to Safe Harbor, which deals with child trafficking and human trafficking. And our goals this year are for our community outreach, education, media campaign, providing a needs assessment to youth serving professionals who work with anyone that would come in contact with a young person that could possibly be at risk of being trafficked or being trafficked, as well as doing an annual training. And we will be implementing a needs assessment over the next month or two with those youth serving professionals, whether it be law enforcement, school, CAC, to develop our training that will take place in November. We have contracted with Love 146 to come in and do a training that is evidence-based for youth serving professionals. It's an education program that we can implement then in schools, and we will allot for up to 20 professionals to participate in that training in October. At this time, we've been in contact with them, obviously because of the current situation, and they are confident that we'll be able to supply this training prior to the end of the year, even if we still have restrictions at that point in time. But one of the things that we did in 2019 was we distributed 35 go bags, and go bags are backpacks full of supplies and materials for young people who may be couch surfing, runaways, coming in contact with either school personnel, law enforcement, another youth serving entity that would give them supplies for a night. And it included health and beauty products, a blanket, hat and gloves, bottled water, granola bars, trail mix, and a gift card to go get a hot coffee if they needed something to drink. And those we distributed actually 27 to the sheriff's office, and every patrol car has a bag in its trunk. And then some of our other agencies took go bags. Most recently, actually since COVID started, we had a call from Restore Planned Parenthood. They have a young woman who they believe was being trafficked or is being trafficked, who was coming in for medical services. And they couldn't ask her because the individual who was potentially trafficking her was coming to all of her appointments due to COVID, that person was not allowed in the exam room anymore. And so they are providing her resources and had connected with Chelsea to get a list of outreach and places that this person could go to, including domestic violence information, safe house. We gave them a go bag. And she has 2 young children, so she's not necessarily ready to leave. But if she needs help, she knows where she can get it now. And they were able to have that conversation with her. So it is happening here, unfortunately, but it is something that we can help with over the next few years and establish a new norm with our services and our programs and departments here, and collaborate better and provide education to our community.
Thank you very much. Appreciate it. Any questions or thoughts?
Jocelyn, I have a couple questions. With a
Yeah.
COVID ID for the last almost 6 months now, have your activities slowed down? I know you had to cancel this, like the ballpark. I think the Liberty building is closed. I'm assuming there's no youth court going on. Schools are closed. Can you comment on those activities?
Yep. So I would say majority. So from the County Youth Bureau portion of it, our funded programs, I would say all but one are closed and not operating at this point in time. I'm waiting to hear back from some of our funded youth rec programs for the summer months. I was copied in on an email with GAM last month, and I know 2 will not be operating this summer, including the city recreation program, as well as Pavilion. The rec programs that we do fund, there are 6 in our county, have been in contact with me, and I should know by the middle of this month if any of them will move forward. Because we are part of that phase 4, which includes recreation and education, a lot of our services cannot take place. We just went through what would have been the busiest time of year for our department. About every other week, we had a major event scheduled or planned, and moving into the summer as well, that we have had to cancel or postpone. And so we are waiting to see, what happens next. Chelsea Elliott is back in the office with me effective today, and we're hopeful that we will have some semblance of normalcy come this fall, where we will be able to get back to doing those things that we routinely do for our community. But it has been a challenge.
Thank you.
Yep.
Other questions for Jocelyn? Anyone? Thank you, Jocelyn. We appreciate your hard work.
Thank you. Have a good night.
as
Thank
well.
you.
County manager, do we have him or do we have Matthew?
I believe Jay is still in the control room as we speak. There's not a lot that I have. I'll just say that those are good reports there from Linda and Jocelyn. Both of them have been working with furloughed employees in addition. I don't know if they've mentioned that or not, but those are excellent reports, and not much to report. Hopefully we'll get some more information. We're glad we're in phase 2. Wish we were in phase 4. And we'll hopefully everyone will behave, and we'll get our way into phase 3 as fast as we can. But there's not a lot of intelligent information that worth passing on, except for pure speculation at this point of what's coming down from Albany.
I see you got your haircut, Matt.
Yeah, I had it scheduled for 4:30 on Friday. Thank God Governor Cuomo gave his directive at 1 o'clock, because I was going to have the real dilemma of, do I go rogue and have an illegal haircut at 4:30 or not? So luckily he gave the order to go to phase 2 at 1 o'clock.
So you didn't have a hard decision to make, right?
Right.
Good stuff. Thank you. Anything else? You all good? Thank you. How about Pamela? Do you have something for us?
Your next meeting is Monday, July 13th.
We look forward to it. Anyone else have anything for the good of the organization?
Do you think we'll still be Zooming it on the 13th of July, or do you think we'll be able to meet?
At
I
present,
don't know the answer to that, but Pamela, do you have an opinion?
the executive order suspending the open meetings law has been extended by the governor through June 28th. So, we don't know at this point what he'll do then, but that's the current status is through June 28th.
So we'll
Thanks.
see you on Zoom again on the 13th there, John.
All right.
We're at his mercy.
Yes.
We are.
Anyone else got anything? How about a motion for dismissal?
So moved.
Thank you, John. Thank you, Greg. All in favor?
Aye.
And those opposed? I didn't think so. We're all good. Thank you all very much.
All
Thanks,
right,
Andrew.
take care, everyone.
Thanks, Andy.
Have a great day.